last speaker this morning is Dr. Nicole Mifsud. Nicole's been a group clinical leader in clinical immunology at the Department of Biochemistry and Molecular Biology and Biomedicine Discovery Institute at Monash University. That's a mouthful. Nicole also did a PhD in transplant immunology in the University of Melbourne, and she also worked with us in the lung transplant service for quite a few years, way back. So without further ado, I'll hand over to Nicole and she can tell you all about what her research is doing. Thanks.
So I'm a T-cell immunologist, and so I work on the other side of things that have been spoken to about today. And so I'm really interested in T-cells that my group mainly works on. And we've been working in the field of lung transplantation for quite a period of time, and we're really interested in these T-cells. So what we notice is that, in a normal everyday situation, T-cells are sentinels of the immune system. They'll circulate around in the blood, and they'll really identify when they come into contact with something that's quite foreign, that was introduced earlier. And what they recognise, I don't have a pointer with this, I'm sorry. Oh, here we go. Is that we have these cells here, which are host cells, obviously, and they present these molecules called HLA, and you've heard about them earlier today. Along with the HLA, they also present what's known as a peptide, and I'll talk to you a little bit about that shortly. But this whole complex is really important for the T-cell to recognise. So these are my T-cell squadrons, and in this steady-state situation, they don't recognise anything of importance. You can see that there's no immune response. But in the setting of transplant, it's very different. The landscape changes dramatically, and now these T-cell squadrons, they can recognise the donor tissue, and in particular looking at the donor HLA that are presenting donor peptides. So it's completely different. You can see now that they become engaged, they become activated, and they can induce very strong immune responses. They can actually destroy the incoming graft. And so the question that we're trying to ask is that, we've got lots of information about the donor HLA, but what we don't know are what are the peptides that have been presented on these molecules. And so I just want to represent a very simplistic model of a cell, and within the cell we have lots of different kinds of proteins, and most of these proteins are structural proteins, but there's also some viral proteins that can be also represented. So what happens in the cell is that these proteins are shuttled through a complex called the proteasome, and in this barrel-like structure what happens is they get trimmed into very short pieces of protein, so these are protein fragments. They are then loaded onto the HLA, and then they're presented at the cell surface for the T cells to recognise. And they're really recognised because of the shortness of that fragment. You can't really represent that looking at really large proteins. So I was kind of trying to think of an analogy here as how I was going to really bring across this concept. And so I was obviously low on sugar at the time, and I was thinking, well, what about candy? So we all know we go to the shopping centre, we stand at that window and we watch people with long pieces of candy, and they just simply chop it up with a spatula. And this is what the immune system is doing. So the proteasome here is the little spatula, these are the proteins, and this is the tiny little morsels that we all enjoy a little bit later on. But this is what the T cells will see. And so for the purpose of this talk, I really think that rather than just thinking about peptides, maybe we can just think about lollies. That's much more better, right? Everybody enjoys that. But what's important is that there's lots of lollies that are represented on the surface of the cell, okay? So you can have up to 120,000, so lots and lots of them. So how is it that T cells can identify them? Well, they don't identify all of them, but they're triggered by some, and it's the sum that we're interested in finding out. So for our research study, we were really interested in not just looking at the lung allografts, but against all different types of organs. So where we have a heart transplant, we have a liver transplant or a kidney transplant, these peptides are likely to be the same. And so we're interested in ones that were not only tissue specific, but all those lollies that were shared across all of the different tissues. And so the aim of this was to really get some organ donor tissue to be able to map out the different peptides, work out how many are actually shared, and from that, how many of those are actually activating T cells. Let's go forward. So we're very lucky in that we're able to access organ donor tissue through the Australian Donation and Transplantation Biobank. And this is an incredibly useful resource for researchers. So what happens here is that organ donors are obviously about to donate their organs to transplantation, but those that are deemed not suitable for transplantation are then open for research. And of course that needs the permission of the families to do that. So over the course of the last year, we've been able to look at a number of different organ tissues. And what we've done is focused on a particular HLA, okay, so that we just keep everything nice and simple. And this HLA is represented in about 40% of our population. And so you can see here from all the different tissues that we've analysed over the last year, we've got lung, heart, liver and kidney. This mainly represents the main transplant organs. Of course, we don't get a lot of kidneys, and the reason for that is that most of the kidneys do go to transplant. We've also looked at some accessory tissues as well, spleen and blood. But for the purpose of today, I'm really just going to present data from the lung, the heart and the liver. And so how do we actually identify peptides? And I think this is a really critical point, is to say, well, how is it that we find all those thousands of peptides? And so we take donor tissues, we grind them up into a very fine powder in the lab. We then able to extract out the HLA and the peptide and then purify that peptide away from the HLA. So we have a very highly concentrated sample of peptides. We then use a very sophisticated instrument called a mass spectrometer, and this gives a sequence to those peptides. And then we can use, public databases to try and identify them and work out what proteins they're actually coming from. We can then spend a lot of time on analysis, and then we had to actually generate our own transplant database to house all of this information. As you can imagine, it's thousands and thousands of pieces of information that we're gathering from these tissues. So what I wanted to show here was that, up to June of 2024 this year, so just over 12 months in the project, we've isolated almost 120,000 peptides just from these one HLA. Of course, these tissues express lots of different HLA, and so we're also capturing that information. So here we have 13 tissues, and what's important to note here is that with these tissues, that we look at the 4 donors that are representative of that heart. You can see that they have about 200 shared peptides. Again, the same for the lung, they have just under 1,500 shared peptides, and for the liver, just over 200 as well. But so when we want to look at the T cells, those numbers are really still large for us to investigate in the lab. And so we want to try and reduce those down to something that's much more meaningful. And so we looked at not only the tissues themselves, but also across the different organs and all of the donors. So this represented around 57 peptides that are shared. Since then, we've done a few more tissues, and just to show you that there are slight changes in the numbers that happen. That's to be expected as you introduce new tissues. So we've sort of now reduced that down to 47. But the data that I'm going to show you today is based on the 57. There's not too much of a reduction, and the 47 are captured in that 57 anyway. So again, back to lollies, because that's where I love. Okay, so we want to kind of group our peptides, and the way we do it is we look at their different characteristics, and it's very similar to lollies. You put the hard centres together, soft centres together, those that, have a certain flavour. And so we're able to group our peptides using some bioinformatic tools into different groups. And this is important because in order to look at which T cells are recognising those, we need to make mixed bag lollies, right? So we need to take some of these lollies and some of these lollies into the various bags and then show them to the T cells. Because if we just take the full jar, well, they're not going to be able to discriminate because they all look the same. So we make these mixed bag of lollies, that we find a T cell response to one of those mixed bag of lollies, and then we ask the question, well, there's lots of lollies in this bag, so how many of those can we then isolate out, and then to try and find the true lolly that's generating the T cell response. And so that's what we've been doing in the last couple of months. And so to do this, we really need to do sort of a transplant in the lab. So we take healthy individuals, we take blood cells from them, and we actually stimulate them with a particular donor. Again, just looking at a healthy individual that represents the donor. This individual has HLA-A2. These recipients do not. So we're looking at an A2 response. And what we do is we generate a whole heap of these T cell squadrons against HLA-A2. And then when we look at the data here, you can see this is just looking at a particular type of T cell called the CD8 positive T cell that's producing a particular marker. So this is interferon gamma, so it's an activated T cell. And you can see with the 20 different recipients that there's a range of different responses that you get. No one is the same. Okay, so you can get some very low responses, as you can see with R4, and you can get some very high level of responses, around 10%, with some of these other donors. And so at the moment, we're sort of embarking on screening for the peptides. And so we've done the first 5 of those individuals, R1 to R5, and I'm going to show you the data for R4 at the moment. And so again, we're looking at these activated T cells that are producing this particular cytokine. This is our positive control, so really nice responses. This is a response to the A2, which mimics what we're seeing here. And then we use a particular cell line that doesn't express an A2, but you can see all the response that goes towards the peptide. And so in this case, we can see that for the mixed bag lollies that are represented in this number 2 here, you can see that we're getting a response. And so it's very early days yet. We've only looked at the first 5. We've still got 15 to go. And then once we've identified the mixed pools of interest, we'll then pull those apart into single peptides to try and identify which ones are actually triggering the T cell response. So where's this all leading to? And I think that's a really important question. And so what we want to do is we want to sort of be able to provide a very simple, non-invasive blood test where we can isolate T cells from recipients. We can, stimulate them with this mixed bag of peptides or lollies and try and work out, which T cells are being activated. And this can all be, performed on very standard hospital infrastructure. So this is a flow cytometer that Demetria mentioned earlier. And of course, this all provides information to the clinician, to the researchers, and so forth. And so this is something that we're trying to move towards. What else can we do with this information? So as I said, we're gaining lots and lots of information about these peptides, but surely there's something else that we can do. And so I've really started to gain an interest in what's called sentinel transplants. So this is where the recipient will not only receive the lungs from the donor, but they'll also receive a small skin flap. And that's normally on the forearm of the individual. And what happens is they use the forearm skin flap as an indicator, an early indicator of graft rejection. So what's happened in previous studies, if you start to see rashes forming in the skin on the forearm, then maybe that's indicative that there's rejection starting to occur. And then that may, prompt more bronchoscopies to be performed to determine that. It's also an easier site for biopsies. Right? So it's much more amenable to immediate investigations rather than having something that's much more invasive like a transbronchial biopsy. I think the important part here is that when we looked in our data set, we can see in the lung and the skin for these 3 donors is that we do have shared peptides across the skin and the lung. So that means is if the peptides are the same here and you're getting T cell responses, it's likelihood that those T cells are also going to recognise peptides that are also presented on the lung, and perhaps those T cells will migrate into the lung and cause damage. And so again, it's just an early warning system that it can actually be monitored in fact by the patient themselves. So that's something that we're moving into, and we're always thinking about ways that we can use our data, not just for this project, but for potentially other projects. So with that, I'll just leave it with the acknowledgements. Of course, there's the people that have done the work on this. Murad Duzaman, he's actually a medically trained postdoc in my lab, and IFRA all generated the immunopeptidomics data or the peptide data. Sanjay and Chen helped me to really define the Atlantis database that house all this information. And of course, we really need to thank the ADTB and the organ donors. So obviously the organ donors themselves and their families for really releasing the tissues for research purposes. Of course, we've got lots of funding agencies, but of course to thank the Lungitude Foundation, Roger and Leslie Gillespie and Tony Pratt for their generosity for this project. Thank you.